Calcification of the intima of aortic knuckle is a common finding in the elderly. Usually it is of no significance. But a separation of the intimal calcification from the edge of the aortic knuckle shadow indicates a separation of the intima from the media, as in aortic dissection. This has been called the calcium sign in aortic dissection. Aortic knuckle, also known as aortic knob, is the distal part of aortic arch which curves posteriorly and continues as the descending aorta. It appears like a lateral projection at the uppermost part of the left border of cardiac silhouette. This description applies to the posteroanterior view of chest X-ray. Aortic knuckle is considered as the first mogul, while describing the third mogul sign of enlargement of left atrial appendage, main pulmonary artery being the second mogul. A prominent aortic knuckle can occur due to unfolding of aortic arch. Rarely it could be due to aortic arch aneurysm as well. Dilatation of the pre-stenotic segment in coarctation of aorta can also cause a prominent aortic knuckle on chest X-ray PA view.